Hi, I'm Jonathan Heilman. I am a board-certified psychiatric nurse practitioner, and currently I work in the inpatient environment at Mountain Crest Behavioral Healthcare Center, affiliated with UC Healthcare System. Uh, I'm very glad that I get to speak to you today to kind of share some of my passions and why I think psychiatric mental health care is so essential. I'll share with you a few, although I'm sure I can go on with you for hours about why I think it's essential, but hopefully these few highlights pique your interest enough to start the conversation about developing a career into psychiatric mental health care. The first I want to point out is that if you love the brain, I maybe can call myself a little bit of a dork, but I would rush to my childhood development brain class and really focus on the different neurotransmitters and areas of the brain that were responsible. It's fascinating, I think, and psychiatric mental health care requires you to have a knowledge of neuroanatomy so that you can understand what medications, what type of therapies, what type of modalities can be best helpful for your patient. And it's from everything from schizophrenia to depression to MS to strokes. Our brains are essential in our functioning, from breathing to processing. So if you find yourself fascinated with the brain, this might be the right track for you. Another thing that I think is imperative that I often talk about are the personal experiences that we have that drive us to this field. Maybe it was a sister, a brother, a mother, a cousin, a good friend, or even yourself that struggled with some type of mental challenge or mental health challenge in the past. And with the right amount of support, with the right medications or therapy, they or you were able to get to a place where you felt more productive and felt like you had more of a purpose. Or on the worst case scenario, maybe there's someone that you know that didn't get the help that they need, someone that suffered with the burden of mental illness, whose life was ended because of their mental illness. And you're striving to make sure that you can see what you can do to make sure that doesn't happen as much. That's something that I think will drive you to this, the personal experiences that you've seen. The other thing that I love about my job is that it's always a puzzle. So if you are detail oriented, maybe you have a touch of OCD like I do, having these different puzzle pieces that you get to put together, collaborative information, what's happening from the point of view from outside, what's happening from the point of view from inside, how long has this been going on, the times, the dates. We don't have a test in psychiatry that I could just draw your blood and say, aha, depression. Instead, it very much comes from this putting together these puzzle pieces to understand not only the labels, the diagnoses, but the symptoms that needed to be treated first. Um, there is some patience that's required in this field. There's a sense of times when you need to take a step back or reach out. And I think that's something, if you enjoy working on a team or if you enjoy reaching out and continuing your education and always striving for the next step in your education, that this would be a good field for you. We don't typically see the results that you go in for a cabbage and your heart is better and you get to go out and discharge. These types of recoveries take time and take energy. So you have to have that type of patience and that type of self-reflection that allows you to reach out for help when you need to and to be part of a team. And lastly, I actually think if you're listening to this, you might understand this last point. There's something unexplainable that keeps drawing you to mental health. I started my career as a surgical intensive care unit nurse, but I kept finding myself talking to the families, telling them what the beeps and the lines and all the alarms meant, and trying to explain to them what was going to happen next. There was something that kept drawing me into that importance of talking and communicating and helping people through that personal connection. So if you find yourself constantly going back to, wait, but I enjoy this. I'm just not about the numbers and the drips. I want to talk to my patients. I want to talk to their families. You might be getting into the psychiatric mental health care field sooner than you'd expect. And it's already a part of everything we do, but specializing in psychiatric mental health care is rewarding. difficult, takes time, but fills you with a sense of purpose that sometimes other healthcare professions don't do. Those are my top reasons why I went into the field of psychiatric mental health care. I encourage you to explore your own, take the time, do the investment in the work, and see how you can find that purpose and that meaning in your healthcare experience.